Good morning. My name is Ondina Love, and I am the Chief Executive Officer of the Canadian Dental Hygienists Association, which we refer to as CDHA. I'm joined today by our immediate past president, Francine Trudeau, and she's a Quebec-based registered dental hygienist. CDHA is the collective national voice of nearly 34,000 dental hygienists working in Canada in diverse settings, including independent dental hygiene practices such as storefronts and mobile, dental offices, public health, hospitals, long-term care facilities, educational institutions, dental industry, and more. Dental hygienists are essential to Canada's health system, delivering individualized oral health care that improves oral health outcomes and well-being. By focusing on prevention and education, dental hygienists contribute to a more sustainable, equitable, and resilient health system. That's why it's essential for governments, policymakers, and health system leaders to recognize oral health as a foundational element of overall health. We're seeing this recognition in action. Dental hygienists are playing a key role in the Canadian Dental Care Plan, which we refer to as CDCP, one of the country's largest social programs. CDHA welcomes the plan's expansion, which is improving access to care for millions of Canadians. Since applications opened in December 2023, over 2 million Canadians have received care through the CDCP, highlighting both the need and the momentum for federal investment. More than 25,000 oral health professionals are now participating, including over 1,200 independent dental hygienists. And while not separately counted by the program, there are many dental hygienists working within dental clinics that are also contributing to the delivery of this important program. With the CDCP into its second year of delivery, our members are saying the plan has helped many patients who otherwise wouldn't have sought care from a dental hygienist. As the new federal government focuses on economic growth and affordability, CDHA urges that oral health care remains central to the agenda. Affordable access to oral care is not just about well-being, it's a smart investment in Canada's long-term economic and social health. CDHA's analysis shows that the overall outlook for the dental hygiene profession is stable. While some attrition is expected in any field, the number of new graduates entering the profession continues to offset and exceed those leaving, helping to maintain a balanced and sustainable workforce. At the same time, where staffing gaps or instabilities do exist, findings from CDHA's 2023 Healthy and Respectful Workplace Survey suggest these are more often linked to challenges in the workplace environment, such as poor working conditions, uncompetitive compensation or burnout levels, rather than actual shortages in the supply of dental hygienists. This study reported that 6 in 10 respondents personally experienced and or witnessed some form of harassment, bullying, abuse, or violence in the workplace. We must also address recent proposals in Ontario and Alberta that would allow internationally trained dentists who are not yet licensed in Canada to practice dental hygiene without meeting established standards. CDHA strongly opposes these proposals. They undermine the preventive care dental hygienists provide and could put patients at risk. We call on federal and provincial governments to uphold professional standards and ensure changes to the oral health system are guided by evidence, equity, and patient safety. That said, we recognize regional disparities in access to care. Until we have comprehensive workforce data across all oral health professions, we can't draw broad conclusions. We urge governments to engage meaningfully with dental hygienist organizations on key policy issues, including education policy and training readiness, international study permits and licensure pathways, labor market trends, working conditions, and regional access. Recent federal changes to international student permits have raised concerns among dental hygiene programs. These changes may impact budgets, staffing, and program sustainability. Finally, we must correct the narrative. Claims of widespread dental hygienist shortages are often exaggerated and unsupported. Let me be clear. Such assertions are unverifiable and false. My remarks today have touched on a range of important issues, from the evolving role of dental hygienists in national programs like the CDCP, to workforce sustainability, upholding safe standards, and the importance of evidence-based policy. Above all, CDHA remains committed to advancing the oral health of Canadians. Working alongside our provincial dental hygienists associations and other national oral health partners, we look forward to working collaboratively with parliamentarians and the new federal government to strengthen health systems, support the dental hygiene profession, and ensure equitable access to preventive oral health care for all. Thank you. I will now turn to Francine to deliver our remarks en français.
Thank you, Ondina. Bonjour. Je m'appelle Francine Trudeau et je suis la présidente sortante de l'Association canadienne des hygiénistes dentaires, connue sous le nom ACHD. Je suis membre de la profession dans la province de Québec. Je suis accompagnée de Ondina Love, chef de la direction de l'ACHD. L'ACHD est la voix collective nationale de près de 34 000 hygiénistes dentaires travaillant au Canada dans différents milieux de pratique, notamment les pratiques d'hygiène dentaire autonomes, telles les cliniques ayant pignon sur rue ou les cliniques mobiles, les cabinets de dentistes, la santé publique, les hôpitaux, les établissements de soins de longue durée, les établissements d'enseignement, l'industrie dentaire et plus encore. Les hygiénistes dentaires jouent un rôle essentiel dans le système de santé canadien en fournissant des soins de santé bucco-dentaire personnalisés qui contribuent directement à l'amélioration de l'état de santé générale et de bien-être. En mettant l'accent sur la prévention et l'éducation, les hygiénistes dentaires contribuent à un système de santé plus durable, équitable et résilient. C'est pourquoi il est essentiel que les gouvernements, les décideurs et les dirigeants du système de santé reconnaissent la santé bucco-dentaire comme un élément fondamental de la santé globale. Nous voyons cette reconnaissance en action. Les hygiénistes dentaires jouent un rôle clé dans la mise en œuvre de l'un des plus importants programmes sociaux du Canada, le Régime canadien de soins dentaires, le RCSD. L'ACHD se réjouit de l'expansion du régime, qui améliore l'accès aux soins bucco-dentaires pour des millions de Canadiens. Depuis les premières demandes en décembre 2023, le programme a déjà fourni des soins à plus de 2 millions de Canadiens, ce qui démontre à la fois le besoin urgent et l'élan croissant de cet investissement fédéral. Plus de 25 000 professionnels de la santé bucco-dentaire participent actuellement au régime, dont plus de 1 200 hygiénistes dentaires en pratique autonome. Et bien qu'ils ne soient pas comptabilisés séparément par le programme, de nombreux hygiénistes dentaires travaillent dans des cliniques dentaires traditionnelles, contribuent également à la mise en œuvre de cet important programme. Alors que le RCSD entre dans sa 2e année de service, nos membres affirment que le régime a aidé de nombreux patients qui, autrement, n'auraient pas pu avoir recours à des soins préventifs donnés par un hygiéniste dentaire. Alors que le gouvernement fédéral, le nouveau gouvernement fédéral, se concentre sur la croissance économique et l'abordabilité, l'ACHD insiste pour que les soins bucco-dentaires demeurent un élément central du programme économique plus large. L'accès à des soins de santé bucco-dentaire abordables n'est pas seulement une question de bien-être, mais aussi un investissement judicieux dans la santé économique et sociale à long terme du Canada. L'analyse de l'ACHD indique que la perspective globale de la profession d'hygiéniste dentaire est stable. Bien que l'on puisse s'attendre à de l'attrition dans tous les domaines, le nombre de nouveaux diplômés entrant dans la profession continue à compenser et à dépasser les départs, ce qui contribue à maintenir une main-d'œuvre équilibrée et durable. Parallèlement, lorsqu'il y a des pénuries ou des instabilités en matière de personnel, les résultats du sondage de 2023 de l'ACHD sur le milieu de travail sain et respectueux suggèrent qu'elles sont le plus souvent liées à des défis de l'environnement de travail, comme de mauvaises conditions de travail, une rémunération non concurrentielle ou des niveaux d'épuisement professionnel, plutôt qu'à une pénurie réelle d'hygiénistes dentaires. Ce sondage a indiqué que 6 répondants sur 10 ont été personnellement victimes ou témoins d'une forme ou l'autre de harcèlement, d'intimidation, d'abus ou de violence sur leur milieu de travail. Nous devons également nous pencher sur les récentes propositions qui émergent en Ontario et en Alberta, suggérant d'autoriser les dentistes formés à l'étranger, qui ne disposent pas encore d'un permis d'exercice au Canada, à pratiquer l'hygiénisme dentaire sans satisfaire aux normes éducatives et réglementaires établies. L'ACHD s'oppose fermement à de telles propositions. Elles compromettent les soins préventifs fournis par les hygiénistes dentaires, mais pourraient également mettre la santé du public à risque. Nous demandons au gouvernement fédéral et provinciaux de respecter les normes professionnelles en vigueur et de veiller à ce que tout changement apporté au système de santé bucco-dentaire soit guidé par des données probantes, l'équité et la sécurité des patients. Cela dit, nous reconnaissons les disparités régionales en matière d'accès aux soins bucco-dentaires. Tant que nous ne disposerons pas de données solides sur la main-d'œuvre sur tous les niveaux professionnels de la santé bucco-dentaire, nous ne pourrons pas tirer de conclusions générales en toute confiance. Nous encourageons les gouvernements à s'engager de manière significative auprès des organisations d'hygiénistes dentaires sur les questions politiques clés, notamment la politique d'éducation et de préparation pour l'entrée à la pratique, les différents parcours pour étudiants étrangers et l'émission de permis d'études post-diplôme, et les tendances du marché de travail, les conditions de travail et les disparités régionales en matière d'accès aux soins. Les changements de politique fédérale annoncés récemment concernant les permis d'études des étudiants étrangers suscitent des inquiétudes au sein des programmes de formation en hygiène dentaire dans tout le pays. Ces changements peuvent avoir des retombées potentielles sur les budgets, le personnel et la viabilité des programmes. Enfin, nous devons corriger la mésinformation. Les informations relatives à une pénurie généralisée d'hygiénistes dentaires sont souvent exagérées et sans fondement. Soyons clairs, ces affirmations sont invérifiables et fausses. Mes remarques aujourd'hui ont porté sur une série de questions importantes de l'évolution du rôle des hygiénistes dentaires dans les programmes nationaux comme le RCSD, à la viabilité de la main-d'œuvre, en passant par le respect des normes de sécurité, de la pratique et l'importance d'une politique fondée sur des données probantes. Avant toute chose, l'ACHD est déterminée à faire progresser la santé bucco-dentaire des Canadiens. Aux côtés de nos associations provinciales d'hygiénistes dentaires et d'autres partenaires nationaux de la santé bucco-dentaire, nous nous réjouissons de travailler en collaboration avec les parlementaires et le nouveau gouvernement fédéral pour renforcer le système de santé, appuyer la profession d'hygiéniste dentaire et assurer un accès équitable aux soins de santé bucco-dentaire préventifs pour tous. Je vous remercie de votre attention. Nous allons maintenant passer à la période de questions. Merci.
Merci. For journalists who joined on Zoom, if you have a question, please use the raise hand function. Pour les journalistes qui se sont joints à nous sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. Marina, please go ahead.
Hi there, Ondina and Francine. Can you hear me okay?
Yes.
Great to see you both. I want to ask you about this misinformation you're talking about. You said it's mainly focused on this idea that there is a shortage of dental hygienists, and that might make it hard for the dental care plan to be fully sort of seen by dentists. Is that misinformation coming from the dental associations?
We've seen a lot of news. There was a petition circulated from some dental organizations stating that there's a shortage of dental hygienists. And there's no evidence to suggest that. Our data shows that whereas there will be probably 25% of the dental hygiene profession leaving the profession within 5 years, the number of new graduates more than exceeds that. What we don't have data for is really having 9 million more, potentially 9 million more Canadians accessing dental and dental hygiene care in Canada. Is there capacity in the current workforce system? So we worked with the Canadian Dental Association and the dental assistants, and we put forward a proposal through the Oral Health Access Fund for some money on some really proper oral health workforce data collection, because we really need to examine our workforce. We recognize that there is maldistribution or maybe maldistribution across the country. There's regions where there may be a shortage of dental hygienists and other regions where there's more than enough supply. But what we don't have is really that kind of hard data, and we're hoping that we get the funding from the government to do that. The other point we want to raise was we have data that shows that a number of our professionals in our Healthy and Respectful Workplace Survey are leaving the profession due to unhealthy work environments. So if dentists would look at a retention strategy, and I'm not saying that they aren't, there's many fantastic employers across the country, but 14% of our members say they're considering leaving and actually do leave the practice or the profession due to unhealthy workplaces. So that is a retention strategy that could be managed.
And just to follow up, obviously the dental care plan rollout is the applications are complete. This is obviously the big, huge cohort, all the people that weren't part of those kind of specific categories before. I just wanted to ask, I guess, both of you, how that rollout is going with this, like millions of people being added onto the program. Is it going well? Have there been any challenges?
Thanks for the question. Yeah, it's the program's been going very well. Independent dental hygienists are reporting, that people are coming in receiving care that have never received preventative care, dental hygiene care. And that's really rewarding for us to hear that it's actually doing what the government set out to do, is providing access to oral health care for those that don't. There have been some glitches in terms of the pre-authorization process, which was launched in November. And so we're still working with Health Canada to work out the glitches in the pre-authorization program that they have with Sun Life. So that is still an ongoing challenge.
Are there any more questions from journalists on Zoom? Yeah, Marina, please go ahead.
Sorry. So just to clarify on that, have dental hygienists started to see that big new cohort yet, or have they not?
Yes, yes, they have.
Okay.
Yeah, yes, they have. Absolutely.
And is it a large amount of people? Is it something that the hygienists have been able to handle in terms of demand, or?
Yeah, our independent practitioners have been able to handle the demand to date. What the challenging part is the whole question around pre-authorization for care. But other than that, we haven't heard any instances where they haven't been able to manage the demand from a dental hygiene perspective.
Okay, that's great. I think that's it. I guess just on that, this is millions more people being added on. Yes. Do you expect any sort of changes to the way hygienists have to operate based on this huge amount of people that are being added on to this program?
What we are seeing is a huge increase in the number of independent dental hygienists. It's probably, we have so many more applications each week, and I don't want to quote you. If you want to contact me later on, Marina, I can give you the data. But we've had a lot more people moving into independent practice. Also, we've heard that some dental offices are full and people are going to see dental hygienists, independent hygienists for the first time. We've heard some really good stories about people going to see independent dental hygienists, especially in more rural and remote communities. The other thing we're excited about is the government has announced that dental hygienists will be included in the student loan forgiveness program, which will start in November. And so that will encourage more dental hygienists to go and work in those rural and remote communities. And we already have lots of interest from our students in actually taking advantage of that. So that should help in terms of the help somewhat in terms of the maldistribution.
Next question, Hannah at the Canadian Press, please go ahead.
Hi. I wanted to ask, where do you think the dichotomy between the messaging from dental associations and your messaging is coming from?
Sorry, I missed the first part of your question.
Where do you think the dichotomy in the messaging between the dental associations and your association is coming from?
I think that it depends on the workplace. So there are a number of there are some regions that there is maldistribution. So there's some regions where there's maybe an oversupply of dentists. So then there's an undersupply of dental hygienists to meet that market demand. So that could be part of the answer to that. And also I think it's really the dental practices need to focus on ensuring that they retain their dental hygienists through healthy and respectful workplace practices. Because if they could retain 14% of their workforce, then you might see some changes in terms of that dichotomy. But we're working with the Canadian Dental Association, and we hope to work with them on collaboration on an oral health workforce strategy. I think that's really critical, that we can collaborate in terms of resolving and ensuring that there is, an equitable distribution of oral health professionals across the country to meet the needs of Canadians, especially since we're going to be adding millions more Canadians through the CDCP.
This maldistribution, it's not a new issue. So why is this coming up now?
I think it's coming up now because of the CDCP. So offices are feeling the pressure of the additional new patients, and a lot of it, they need hygienists. They need the preventive care in there. And so the other thing that's coming up now is that there's an increasing number of independent dental hygienists. And so if they're not working in traditional dental clinics, it could cause a shortage in dental offices because dental hygienists are practicing independently.
Thank you.
Any more questions on Zoom? Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
Merci. Thank you.
Merci.